Hi guys, let's talk about epidurals. Everybody loves epidurals. The big thing to know about epidurals is that they're not instant, okay? The nurse will check your cervix just to make sure you're not like crowning. It's been known to happen. And then they start giving you IV fluids. Epidurals are really good at dropping your blood pressure, and that makes you feel gross and your baby feel gross. So they start running fluids. And they page anesthesia, get the room set up, get you in position. And then when anesthesia comes and actually starts the epidural, it takes time. It takes 20 to 30 minutes for the medication to set up. So if you are in intense pain, I encourage you to take a dose of IV pain medication to kind of bridge the gap until the epidural takes effect. For the epidural, the nurse will help get you into position, which is kind of like sitting on the edge of the bed in an angry cat pose. Like imagine pushing out your lower back. An anesthesiologist will come in and they'll explain the procedure and talk about risk factors, any history you have with anesthetic. And the theme of anesthesia is it's cold. So you get a cold wash on your back, you get a cold drape on your back. You feel some poking and prodding. The worst part is a bee sting, kind of lidocaine to help numb the spot where they're going to put the epidural. Then they put what's kind of a hard guide in to get to the right space in your spine, and feed a little wire, which is like a little straw, and pull the hard part out. So what you're left with is this kind of soft noodle-like tube into your spine that continuously gives you medication until you're done having a baby. And then they tape you up. So if you have a hairy back, just plan ahead, okay? After the anesthesiologist is done, the nurse lays you down really quick and will check baby's heartbeat, because epidurals can drop your blood pressure, which can make you feel gross and baby feel gross, and that's our first concern. You may even throw up during this time. And so the nurse is going to be monitoring your vitals very closely. Things to know about epidural: once you have one, you're in bed. You're not lying still. The nurse will help you move back and forth every 30 minutes or so. Because the side you're laying on gets more medicine. So we don't want your bottom side numb to the world and your top side feeling contractions. Kind of keep you going like a rotisserie chicken. The other thing they'll probably do is have you use a labor ball that looks like a minion. It really is. It's a peanut ball that helps hold your knees apart and keep your pelvis open even though you're laying down, to help baby progress down the birth canal. And you will get a catheter because you don't get to pee by yourself anymore.
Mama, what you doing?
Come here, short stuff. Come be in my video.
I just put one there. That's a good spot for it.
Okay, come here.
Huh?
This is Charlotte. This is my C-section baby. Okay? So things to know about epidurals: they run the whole time you're in labor until you're done and the baby's out and the doctor's doing repairs. And then they turn it off, and it can take some time for it to wear off. So after you're not numb anymore, that's when the nurse will help you get up. The other thing I wanted to tell you about pain meds during and after labor is that if you have a history of narcotic or prescription drug abuse, these drugs may not work as well for you. And I encourage you to be honest with your doctor if you have that history. Epidurals, you won't be paralyzed. They can take away pain, but they cannot take away pressure. So you may find still when you're transitioning and you're crowning, it's a very intense sensation. And the only answer is to push the baby out. Just remember, there's no gold medal one way or another if you get through labor and delivery without having pain.